barbell back squat. A couple different variations of a barbell back squat being a high bar barbell back squat and a low bar barbell back squat. When I have a high bar set up, I'm going to be placing the barbell on what I tend to call my upper load shelf, which is our upper trap. So if you take your hand and you find your shoulder blade, you'll find a spine or a bony piece that comes across. On a high bar, the bar is going to sit up on top of that on your upper trap. On a low bar, it's going to sit down below that. So it kind of depends on what our focus is. If we're doing a low bar, it's going to typically load the back half of my body more than the front half. If I'm doing a high bar, it's typically going to load my quad a little bit more that way. Most people have an issue with the shoulder mobility to get into a low bar, which results in their hands having to go really wide, and then they lose a lot of back tension. So unless you're a power lifter, I tend to have most of my clients squat with a high bar or even using a safety squat bar. So if you have access to a safety squat bar and you have limited shoulder mobility, that guy's going to be your best friend, so we're not cranking on those shoulders into external rotation to get under the bar to create good stability. So lots to talk through here with positional bracing and breathing. A lot of people will really lose the tension in their abs when they go to squat. So they lack thoracic extension and glenohumeral external rotation. So in order for them to get into that back squat position with a barbell, they'll really overextend their low back, and it changes the length-tension relationship of the musculature of the trunk, and they have a hard time bracing. When that happens, I go into an anterior pelvic tilt, so it already places me in more hip flexion than usual. So then when I go to squat, a lot of people will develop irritability on the front side of their hips when they're squatting due to the lack of mobility in the upper half. And then the other piece that couples that is a lot of people are really lacking ankle dorsiflexion. So if my knees can't translate forward, in order for me to get to depth and my upper back is locked up, most people are going to shift their hips back more, further increasing the demand of the butt, low back, hamstring, but it also brings them into more and more hip flexion. So if you're somebody that gets a little irritable in the front of the hip, you may feel a pinch or some sort of uncomfortable sensation in your hips when you're squatting, start by going into a high bar, bringing your hands a little bit wider, or even going through an external rotation screening test to make sure you can dissociate glenohumeral external rotation, adduction, to get into that good safe position from thoracic extension. See other videos on how to screen that. So most of our clients benefit from a heel lift because that gives them that dorsiflexion like we just talked about. So when we cue a high bar squat or a back squat in general, we want people to feel that tripod effect under their big toe, pinky toe, and heel. And we want to have a slight forward pressure. So if I have the bar on my back and I lean forward a little bit, I'm going to feel the pressure build under the front half of my foot. From there, I want to do a really good job of bracing, keeping everything in neutral to where my knees just bend and I descend into that bottom position, and then I can drive through a flat foot back to the top. A lot of people, when they come out of the bottom position, their knees will come back and they kind of do a little bit of a deadlift combined with a good morning. You want to keep your knees forward as you drive out of the hole so we can use our quads to combine with our hips to get back up into a fully extended position. So there's a lot going on with the back squat. Everyone's stance is going to be a little bit different. So you do not have to be someone that squats with your feet hip width apart and your toes forward. Find whatever squat position allows you to get into that bottom position the most comfortably in your hips, your knees, and your ankles while keeping an upright torso, because our goal is to, again, use a high bar back squat. And then arm positioning. If you're someone who's really limited in external rotation, you may have a hard time creating tension in your back when you get set up, so you have to get your hands a little bit wider, okay? Most people are going to really benefit from the cue of when I get under the bar to squeeze my shoulder blades together as hard as I can and then drive my elbows toward the wall, because that's going to help prevent that forward tipping and my knees going back motion when I come out of the hole. So if my elbows are driven hard toward the wall, my upper back or my thoracic spine is locked up, so I'm less likely to do that and more likely to drive straight out of the hole. Now, if you're someone who has issues with shoulder mobility, driving into that external rotation may be irritable, again, use that safety squat bar or widen your hands out. Another cue is if you have a hard time driving those elbows forward, is you want to squeeze the shoulder blades together and then kind of pull the bar into your back. A lot of people get preoccupied with just trying to stand up when they're doing a squat. We want you all to get really used to trying to push your back into the bar and your feet through the floor at the same time. So you're kind of pressing away from each other to come back into that top position. So, and then the last piece, which I mentioned right at the beginning of the video, is breathing and bracing. So when I get set up, I personally tend to squeeze my shoulder blades back, and I have limited external rotation, so I have a hard time driving my elbows forward. I get cranky shoulders when I do that, so I keep my elbows behind my torso, but I pull the bar into my back. Now, I'm using a heel lift, and when I get set up, I'm checking to make sure that I'm not into this excessive anterior tilt position of my pelvis. So I'm going to close my rib cage down, and then I'm going to breathe out into my belly. So big breath in through my nose, create tension on my abdomen, pressing out into my obliques, pressure forward into my big toe, and then from here, I'm just bending at my knees, going to that bottom position, and then driving back to the top. A lot of people will lose the tension in their abdomen and that brace where they kind of suck in. You want to pretend that you have a belt around your waist that's maybe one notch too loose, and you're trying to breathe out into your obliques or push out into your obliques. Watch this video a couple times. There was a lot of technique that was covered. It's vital that we're really bracing, setting up good in the top position, going through a full range of motion before we start increasing a lot of load, because we want good fundamental movement patterns before we increase the load. Think about building a house on bedrock versus quicksand.